Organs. We have many different kinds that all have many different functions. We know that they are all essential to our survival, so what happens when something goes wrong? In the medical community, organ transplants became a procedure in the 1950s that have since saved millions upon millions of lives. Although through years of development and practice, this surgery has become highly successful, the complications start to arise after the surgery. The biggest problem with organ transplants is rejection. To understand why organ rejection happens, we must first understand how our immune system works. Our immune system is comprised of many different white blood cells, but they all essentially work together to defend the body against foreign substances called antigens. One way the immune system is able to get rid of antigens is through antibodies. These antibodies have antigen binding sites where they are specifically matched, a lot like a puzzle piece. This is also how vaccines work, by introducing a smaller recognizable amount of a strain of an antigen. Later, if the person comes into contact with the antigen, it will be recognized faster due to the matching process. In an organ transplant, the white blood cells think that the new organ is an antigen and is going to cause harm to the body. To avoid this, they must be matched very closely. In the instance of a sibling donor, they will have a 25% chance of inheriting identical haplotypes, but they are also only able to donate bone marrow, a kidney, or a section of their livers. For all other vital organ donations, the doctors have to use cadavers. The problem with cadaver donors is that the chance of them having identical haplotypes with the recipient is extremely low. So to improve the chances of an organ being transplanted successfully, patients can take immunosuppressants. Taking these will cause immunosuppression, which is defined as the act of reducing or restraining the efficacy or activity level of the immune system. Immunosuppression can also happen naturally in the instance of diseases such as AIDS or other events like malnutrition or aging. In general, immunosuppressants work by targeting a white blood cell called the leukocyte. There are two ways that they can target this white blood cell. First, they can diminish the amount of it. Secondly, they can limit their function. The problem with taking immunosuppressants is that even though it is preventing the immune system from destroying a vital organ, it is also limiting the immune system's overall function. This could result in many negative outcomes, such as a higher rate of infection, contracting cancer, and also deleterious reactions with other medications. This is what scientists are currently trying to fix. They want to develop new immunosuppressants that can still prevent organ rejection, but at the same time limit the side effects that come with it. There was a study by the University of Cincinnati in June of 2019 on the immunosuppressive drug betacept, where they found that it has benefits in treating kidney transplant recipients with the elimination of other side effects. Betacept is a modified version of the drug betacept, which is used to treat rheumatoid arthritis. Their goal was to use this drug to eliminate the use of steroids, but still provide a useful immunosuppressant. They ultimately found that the patients given betacept showed slightly higher rates of rejection, but lower rates of GI toxicity, neurotoxicity, electrolyte imbalance, and other adverse effects associated with immunosuppressants. There is a trade-off with this drug, but it is definitely a step in the right direction for the future of organ transplants. Hopefully, with continued research and work on this topic, we'll be able to further eliminate any side effects that come with immunosuppressants. Thanks for watching, and check out the link below for additional information.